How are you today? Good? Yeah, good. That's great. Well, what can I help you with? Okay, yeah. You need to check in for an appointment? Okay. Give me 1 second. Let me finish up what I'm doing. Okay, sorry about that. Okay. Hi. Okay, so to start off your appointment, I need to fill out a brief questionnaire with some of your medical history and background. So if you wouldn't mind just having a seat, I have this questionnaire that I need to fill out with just some information before your treatment. So if it's okay with you, I'm gonna go ahead and first take my headphones off because I don't need those anymore since we're now starting an appointment. So I'm going to ask you a couple questions, and I just want you to answer to the best of your ability. And then after that, we'll be able to start with your external exam, and then from there we can go on to the actual appointment. So let me just put these up. Great. Awesome. Okay. So can I have your first and last name, please? Okay, thank you. And can I have your date of birth, please? Okay, great, thank you. And can I also have your sex, please? Male or female? Great, thanks. Okay, so now I have that simple information. What I would like to do is talk about your visit history, and then we're going to talk about why you're here for your appointment, as well as just things to do with your smile, and just for some background and understanding about further appointments and setup treatments. Okay, so first of all, my first question is, how often do you visit the dentist? And then it's unknown, never / first visit, 1 to 2 times a year, more than twice a year, irregular, or emergencies. Okay, yeah, sure. 1 to 2 times a year. Good. That's normally what we would recommend. Every 6 months or so, unless you have an emergency, or say you have braces or other dental appendages that need more frequent maintenance. So great. That's awesome. Good to hear. Okay, I'll mark that down. So what was done at your last dental visit? Was it a normal cleaning? Was it per se surgery? I hope not, but sometimes that happens. Okay. Yeah. Just a normal visit, checkup, yeah. Wonderful, great. Okay. And what is the reason for your visit today? Yeah, of course. Yeah, just a regular cleaning? Okay. Okay. You haven't been, normally you go pretty often, but you haven't been in the past year or so? You maybe have a couple cavities? Okay. Not a problem. Great. So I guess to go on to my next question, when was the last time that you had a dental cleaning? If you can give a rough estimate. Okay, about a year ago. Okay, that's a bit longer than what we would normally want, especially for a regular patient. But again, we do treat everyone, whether you come very frequently or only a couple times a year or not at all. We're happy to help anyone out that needs help. So, okay, great. 1 to 2 years, perfect. Okay, now to go to your current problem. Are you having any discomfort at this time? such as your jaw's sore, or your teeth or your gums are hurting, or there's inflammation. Okay, yeah. Great. Okay, and how long has this condition been bothering you? Okay, a couple weeks? Yeah, not a worry at all. And how can we address this problem for you today? Yeah, no, of course. We offer, dental x-rays, dental x-rays and regular cleanings, as well as we can recommend you to a surgeon, and we also have an in-house surgeon that will take care of some of the less major issues. Otherwise, we can send you to one of our specialists for a consultation. Yeah. Yes, of course. Yeah, no, we can set you up today with an appointment for a regular cleaning, and then we can have the doctor, which is me today. We're low on staff, so I'll be doing everything. But we can have, I can take a look at your condition and decide if there needs to be further treatment, and we can go from there. Okay? Yeah, you're welcome. Okay. Now for a bit of smile cosmetic. We normally ask these questions just to help understand a patient's motivation for coming to the dentist. That might sound a bit silly in practice, but we ask these questions just to get a better idea of, say, why you've come to the dentist, or if there's anything that we can do with treatment as well as with support to help offer you your best smile, and to also have you feel comfortable to come back for treatment if need be. Okay, so my first question is, what 3 things would you change about your smile or your teeth? Yeah. Okay. Yeah, you potentially want braces or something. Have you had braces before? For a little while? Okay. Yeah, I did too. I had my braces for about 4 years, which is a bit on the longer side, but it was mainly they didn't want to speed up the process of straightening my teeth, so as I can attest to that, because getting your braces tightened can be a bit uncomfortable sometimes, so it's nice to have that process be a bit slower so that you're not shifting your teeth around as much, but then that can also be a bit more costly, so we can definitely work out different scenarios for you if need be. So okay, so potentially looking at braces. Okay. And you just want your teeth. Oh, okay, yeah, and you want your teeth to be just a bit wider. Yeah. And of course, I think everyone kind of wants that. We can definitely make that happen with some simple treatments, yeah. Okay, so of these 3 things that you've listed, what's the most important to you? Okay, yeah, just wanting a good smile. Yeah, even if your teeth aren't completely straight. Yeah, of course, not a problem. Sorry, my desk keeps creaking. It's I don't know. Considering how long I sit here every day, it kind of gets a bit wonky sometimes. So I'm sorry if it makes noises like that. Okay. So, what are the cosmetic procedures in which you are interested? Okay, yeah, just a regular cleaning and just to kind of go from there. Yeah, of course. We can totally do that for you. Yes. Okay. Some quick questions about your past experience. So, do you have a fear of the dentist or dental work? And yes or no. You don't have to elaborate. You can just signify your response to that. You have okay. Yeah, it's understandable. A slight fear of the dentist. Yeah. I think that's normal too. It's a bit of the unknown per se, but don't worry, I don't bite. I'm friendly. Okay, what specifically do you dislike or fear the most? The dentist drill? Yeah, that's a common one. Mm-hmm. I assure you, it's not as painful or crazy as it seems, as it's made out to be. It's just kind of loud, but that's the only real issue. And of course, we, for the more, I would hesitate to use the word, but for the more invasive procedures, we do use Novocaine and some general anesthesia to, so that there isn't any perception of pain should there be any during your procedure. Yeah. Okay. And are there any problems with your past dental experiences that you would like to avoid? Yeah, sure. What I mean by that is basically like, are there any situations that you've had in the past where you felt uncomfortable or you felt that there was something that unnecessary that could have been easily avoided, such as, I don't know, say, maybe a dentist in the past being a bit too rough or not meeting your needs in terms of comfortability or, say, giving you all the financial options, etc. Yeah, okay. You just kind of want the dentist to explain a bit more of what they're doing as they're doing it? Yeah, of course. That's normal. Okay. Okay, now for some general history questions, and then that'll wrap up the evaluation section. Any past complications with dental work? No? Okay, that's good. Good to hear. Great. Have you ever had your teeth straightened? Yeah, you've had braces in the past, right? Yeah, but you potentially want them again. You didn't wear your retainer long enough or something. Yeah, that's understandable. Okay, we can do that for you. We can schedule an appointment. So, are your teeth sensitive? Do you seem to be a bit more prevalent to, say, pain that normally wouldn't necessarily be there because of, say, poking around at your teeth with dental tools or whatever? Okay, yeah, I'll take that into consideration, of course. Yes. Okay. Do you feel you have bad breath at times? Okay, yeah. Write that down. And do your gums bleed when you brush? Sometimes? Yeah, okay. I'll write that down as well. Sometimes that can just be caused by, say, a lack of flossing or just a bit of infection, but normally that could be straightened out, no pun intended, pretty easily. So that shouldn't be a big issue. Okay. And have you ever had any gum treatments? No? Okay. And does food wedge between your teeth at all easily? Or, do you have any, gaps in your teeth? I can't see any. No? Okay, cool. Okay, and now for a bit of jaw evaluation, and then I'll get to the physical part of the exam. Do you grind or clench your teeth? Okay, yeah. Yes, write that down, okay. And do you have pain in your jaw joints? When you open and close your mouth, do you get any kind of pain or popping or clicking? No? Okay, that's good. Great. Good to hear. Awesome. Okay. Do you feel you have broken or chipped teeth without reason? At all? No? Okay. Good. Do you wear a night guard at all? Like a kind of like a retainer at night when you sleep? No? Okay, yeah, that maybe could explain some of the grinding your teeth habits. Sometimes implementing a mouth guard when you sleep can help lessen the habit of grinding your teeth or kind of locking your jaw, which can also release jaw tension because, when you sleep at night and you grind your teeth, you're activating your jaw muscles, the muscles that connect your mandibula to your skull. And that can wear those out as well, and they get sore and overstressed. So it'd be like trying to chew for hours on end. It hurts. Yeah, okay. Great. Okay. So I think we finished the evaluation, so I'm going to put this in your file real quick. Great, awesome. Okay, now I'm gonna go ahead and start on the physical exam. This isn't the cleaning yet, it's just feeling around and making sure that I don't feel anything abnormal, and making sure that just everything is working properly, and also I can kind of get a bit of a visual on the health of your teeth before we start the exam, and then you can ask me any further questions during the physical part of all. So I'm gonna go ahead and get ready for that, and I will be right back. Okay, I'm back. I've got a couple of things with me. So I've got a mask. We wrap all of our masks individually, so I have to, unwrap that. But okay. So I'm gonna put the mask here, and I'm gonna grab a couple of things. Got some gloves that I'm gonna put on, and then we'll get started with the just kind of feeling around your jaw and stuff. So we'll just start there, okay? So I'm gonna put my gloves on. Yeah, go ahead and get comfortable. Just sit up though, so I can just feel your jaw and stuff with my hands, and just write those things down. Okay. So I'm gonna go ahead and put my mask on, and then I'm gonna just start by feeling around your jaw, and not going in your mouth per se, but just feeling around the edges of your jaw for any abnormalities that could be present. So, okay. All right, so if you'll just sit forward, please. I'm gonna feel. Okay, and open, please. Great. Okay. I'm gonna feel here and here. And here. You don't feel anything, that's good. Okay, can you close your mouth and just kind of bare your teeth? Perfect, great, okay. Still not feeling anything, which is good. It's just maybe a bit sore right there. Oh, that's a bit sore, okay. Kind of right up there by the, by your ear, okay? And open again. Great. I do see a bit of plaque, just as a side note, but we'll get to that in the cleaning, so don't worry about that, it's okay. Okay, I'm gonna feel towards the top, okay? Going down the sides a bit. A little lower. I feel something right there. It doesn't look like it's anything major. It might just be slight inflammation of your lymph nodes, maybe. So let me feel that again. Okay. Great. Okay. One more time, say ah. Awesome. And just stick your tongue out, just so I can feel underneath. Great. Awesome, okay. I'm gonna write that down on your file quickly. Just so I can take note of that, you know, it's good to have things on file. Okay, feel that again. Great, okay. Now we're gonna go ahead and just start with the cleaning. So I've got my dental tools here. And I'll just, you know, walk through a small step-by-step of what each tool does, just so that you have an idea. You know, as you explained in your questionnaire, that you've had some bad dental experiences in the past where you felt like everything wasn't exactly explained to you in a way that made you comfortable. So this might help you relax a little bit. Okay, so the first tool I have is a mirror, and this is just, you know, it's a small mirror. See, very small. I mean, it's the size of my thumb, to give you perspective. And I use this tool, and you know, either by itself or with the other dental tools, just to have a look in your mouth and to look around and just see things that I wouldn't be able to see as easily with just my eyes. So this helps just clarify things that I'm looking at. Okay. Next, this tool is to test the depth of your gums. It's got little tick marks on it on the side. So for example, say that this is your gum here. This is your gum line. You just use it to go a little past that and test how deep the gum tissue is in relationship to your teeth themselves. So this can help me figure out if your gums are receding in certain spots or if there are pockets of infection, and so this just helps with that. So next I have a scaler, and this tool is simply it's kind of what it sounds like. I use this to pick away at the plaque on your teeth. You know, and take the plaque off your teeth. Essentially, that's kind of all it does. Yeah, so it's very simple, very small. It's pretty harmless, really. It's not super sharp, but it's sharp enough that I can just get the plaque off your teeth. But this shouldn't hurt at all. So, and lastly, these tools. It's kind of funny looking. It's got a ball thing on one end here, like that. I don't know if you can see that. Looks like that. It's kind of like a little egg shape. And then this side has a little ball on a tip here. And basically what I use with this tool is I use it to tap on your teeth lightly, just to make sure that they're not decaying or anything really. Because I wouldn't want to use this tool on your teeth, just because that could lead to scraping off things that I don't want to. You know, or you're catching on a piece of gum, and that's not fun. So this is just simply to test the depth of your gums, and it's quite harmless. You can poke it all you want. It's not sharp at all. There's a little ball right there on the end of it, on both ends really. So pretty harmless. So anyways, I think we'll go ahead and get started. I'm going to take a look at your teeth, and we'll get started, okay? Okay. I'm gonna have you open, please, just a little bit. Great, awesome. I'm gonna look around. I'm gonna take my probing tool and just check. But first, I need to change my gloves, so let me go take these off and put some new ones on quickly. So I'll be right back. Okay, I'm gonna put some new gloves on. Ooh. quickly, and we'll go ahead and start cleaning your teeth. Although, these gloves seem to have a bit of too much powder in them, so let me just fix that quickly. Great. All right, I'm just gonna look around, check quickly, just, let me see, yeah, okay, I see. Yeah, it looks like you haven't been to the dentist in a while, but we can certainly fix that. Looks like that might be a cavity right there, and I think one back here. Yeah, all right. I take my mirror and just look around a little bit. Okay. Looking at all your teeth. It doesn't look too bad, but certainly looks like you need a good cleaning, so we'll definitely do that today. But, yeah, okay. Well, I'm gonna go ahead and start cleaning your teeth. First, just gonna let you know, we're gonna start off with your, just cleaning your teeth. But first I need to measure your gum level before we start the teeth cleaning. So, again, here's my measuring tool. I'm gonna just check your gum level and count your teeth. Okay, so I'm gonna start at the back. 1, and 2, 3, 4, 5. This area here with this supposed cavity, the gum tissue looks a bit deep, so we'll definitely have to check that out a bit further. So, okay, 6, 7, 8, 9, 10, 11, 12, 13, 14. Okay, great. Now I'm going to check the top teeth. Just do the same thing. So, all right, open wide. Great. Thank you. 1, 2, 3, 4. Stay open, please. Good. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Great. Okay, awesome. So I'm just gonna write that down in your file that you obviously have all the teeth that you're supposed to have in your mouth. We wouldn't want you missing any, so. Great, awesome. Okay, now I'm actually going to start just picking all the plaque off your teeth and getting rid of that because no one wants to have plaque on their teeth. So I'm going to go ahead and start. So I'm going to start with the back first because that's just get the hard stuff out of the way and then go to the front. So I'm going to take my mirror in one hand gonna just start cleaning your teeth. So here we go. It looks like you have a decent amount of plaque buildup, but could be worse, I suppose. But like I said, I'm glad that you came to the dentist just to have all this checked out. I don't think anyone ever wants to have bad teeth or anything. Looks like there's a bit of plaque buildup there, so let me take my tweezers, which are here, and I'm gonna just see if I can remove this. Let's see. Oh, there we go, great. It's coming off. Awesome. Looks good so far. There we go. There's just hopefully, and I would recommend also that next time you come to the dentist, it would be great if you just brush your teeth before you come, but that's okay. After all, I mean, either way, we'll brush them again here, but it's nice to just, have a patient that comes in and their teeth are clean, especially if you've eaten. But not a worry. So we're gonna go ahead and just start trying to remove as much plaque from your teeth as possible. And then we'll go back and floss and everything, so it should be all good. Looks like this is some extra decay buildup, but I'm gonna... Does that hurt at all? No? Okay, good. Let's see if I can... Let me know if this hurts. I'm gonna try and get this out. Oh yeah, there we go. That is some food buildup right there. Okay. Does that feel better? Good. Alright. I bet that feels a lot better, yeah? Okay. So I'm gonna keep going. Clean all your teeth. Yeah, I will say, you need to make sure that you floss 2 times a day, or at the very minimum, once a day. That helps decrease the chance of food getting lodged in your gums or in your teeth, in between your teeth, which then can cause infection and decay. So just remember the twice a day rule, and clean your teeth twice a day, with flossing if possible, and then make sure to brush after every meal, or at the very least also 2 times a day. So just remember the 2 and 2 rule. All right, I'm gonna go ahead and brush a bit. I do have an electric polisher that I will use, but for the time being, I'm gonna see if I can't get some of this decay off. There's some of this plaque built up with just the toothbrush. So we're gonna go ahead and get started. So I'm just gonna brush. Hopefully this will get a bunch of the decay off, like I said. It's amazing. Brushing does wonders for the teeth. Alright, that's looking better already. So I'm gonna keep going. You're being a great patient, keeping your mouth open for me. Thank you, I appreciate it. Some people don't want to keep their mouth open, which is understandable, but you gotta keep your teeth clean. So the only way I can really do that is if your mouth is open. So, alright, these look good. And then we'll start on the top row as well. Alright. Great. Those look good so far. All right, I'm gonna go ahead and start cleaning the top of your teeth. I'm gonna go ahead and get my other tool out again and just start poking around. Oop, as I drop my pen on the floor. Okay, so just hold still. Oh, there we go, look at that. Yeah, it's good to get all that off. Some more. Great. And I'm gonna put my finger in your mouth just to keep it open so I can. Here's another big chunk. There we go. Great. And again, like I said, no need to be embarrassed. It's just, it's good that you came to the dentist so we can take care of this issue before it gets worse. You know, we want you to be, like I said, leaving with a happy, healthy smile versus having a fear of going to the dentist and just not getting that issue resolved. Okay, you're being great, though. Thank you so much for keeping your mouth open. It's awesome. I'm going to brush a bit just to try to get some of this off. So if you'll open wider, please. Yeah, great. Awesome. Yeah, see how much is coming off with just some simple brushing? That's awesome. Great. Wonderful. All right, I'm gonna go and take my tools and start on the other side. So if you'll turn this way, please. Awesome. Great. Actually, turn back that way. Great. Okay, I'm gonna start over here. Just get that plaque out. Like I said, we don't want you having tons of plaque in your teeth because that leads to infection and just other unpleasant, yucky stuff. So, there we go. It's great so far. We're getting there. I'll take my mirror. Let me see if there's anything on the top. Oh, okay. There's a bit of decay up here, so I'm gonna take my tool. I'm going to pick away at it with my dental tool, and hopefully we'll get it off. Oh, I see something. Look at that. There we go. That's awesome. Great. Looks like there's a bit more, so I'm going to try my best to get rid of all of it. All right, awesome. Looks good. Otherwise, just, make sure that you brush your teeth every day. And then you won't have as much plaque buildup. And then, your teeth won't hurt as much either. All right. Awesome. All right, I'm taking my toothbrush again and just brush. Great. You're doing a great job staying still for me. Some people just can't seem to sit still sometimes. All right. Just keep brushing. Check around the side here. I'm going to get the back of your teeth. Great. Awesome. Turn this way. Wonderful. I want to check here. They'll look good. There's a bit of buildup here, so I'm going to get that. And some on your molars, but that's also normal, so don't worry about that too much. All right, the back of your teeth look pretty good, and now we're going to move to the front of your teeth, so just hang tight. Okay, now we're going to start on the front of your teeth, and obviously it's a bit easier for me to see what's going on the front, so I'm just going to take my scalpel tool here. Sorry, not my scalpel tool, it's my scaler tool, and I'm just going to start picking away at your teeth. Okay, so here we go. The good thing is your gums don't look too inflamed. They still have a very pink color. But like I said, it's good to keep flossing, obviously. So just make sure that you do that after every meal, and make sure that when you do floss, that you go in between all of your teeth, not just the ones that you can reach easily, because that'll help, like I said, prevent buildup. All right, turn that way. Great, thank you. It'll help prevent buildup, and your teeth won't be as sensitive, and your gums won't bleed as much either, which is great. You know, no one wants to have bleeding gums when they brush their teeth. But otherwise, your teeth look pretty good. They're very white, so it's just important to make sure that you do brush your teeth every day. Okay, turn that way. Great, thank you. And I'll take a look at that section in the back too when I finish this bottom row. I'll make sure that we get everything. All right, open wide, please. Just a bit. Thank you. Great. All right, I'm gonna focus on this a little bit. This area. Oh, there's some stuff. Awesome. And bite together. Alright, looks good so far. We're getting there. Slowly but surely. You can't rush things like this typically. I'm gonna start on the top row just to get all this stuff off here. But first, I'm gonna change my gloves again, just so a fresh pair. So let me go grab a couple. I'm gonna be right back. Okay, I think I'm gonna go with green for this one round. Sometimes the gloves get a bit slippery from just removing all of the plaque and stuff, so it's sometimes a good idea just to change them out. Oh, stay still. Sorry, I didn't mean to hit you. Okay, great. So, got my gloves on. I'm gonna get back to work cleaning the top of your teeth. So I'm gonna start on this side and just getting all of that out of there. Oh. There we go. Okay. I'm gonna switch sides. Alright, good. Close. I'm going to take another look at the bottom teeth just to try to remove some more of just the plaque here. So yeah, I'm going to just do that for a bit. But you're doing great. Holding very still, which is good. So looks pretty good to me. I'm going to take my toothbrush. And I'm just gonna brush again a couple of the different areas. So here we go. But again, please let me know if something hurts or if it's something that's irritated. I want to make sure that I'm not hurting you. But sometimes this can be a bit uncomfortable. But you'll just have to work through that. And you can ask me to give you a break or something, but I want to make sure that I get everything as best as possible. All right, now I'm going to start cleaning the upper portion of your teeth. Just brushing lightly everything off. Great. Teeth are looking so much better. I bet that feels amazing. Alright, and I see this part back here, so I'm just gonna. Okay. It feels kind of soft. I'm not sure. It might be a bit of decay. It might be the beginning of the cavity, but so we're gonna go ahead and try to remove it. Because your teeth look great except for that one spot, and so I'm gonna just try and remove it without hurting you or anything. See, it's kind of coming off. So we just need to try to get all of it off. Yeah, just hold still. I know, I'm sorry. My fingers are all in your mouth, but see, it's looking a bit better. So I'm going to try and get the rest of it off. Alright. It's coming. That's good. Alright. Yeah, you just got to be mindful of where you're flossing and brushing, or where particles of food could be stuck in your teeth, because you want to make sure that you get all those areas when you brush your teeth, because otherwise it just leads to more buildup, and eventually to something like this. So let's see. There we go. Cut the rest of it off. Great. I'm going to just use my scaler tool just to clean the rest of the tooth and make sure that there isn't anything left that could be more built up or make the situation worse. So I'm just gonna do that. Awesome, you're doing a great job, though. Thank you. All right, gonna brush a bit more. And I think it looks pretty good, otherwise. All right, now I'm gonna go grab some floss, so we're gonna floss your teeth quickly, okay? All right, so I've got some floss, and it's mint flavored. So I'm gonna go ahead and take a small strand of that. All right, and we're gonna go ahead and start flossing your teeth. Okay, so if you'll just hold still. Yep, it's amazing. Flossing is really good for your teeth. It helps get rid of excess bacteria, and it gets the food particles out that your toothbrush can't get to. So that's always great. Okay. So we're gonna keep flossing. There you go. Get some more floss, and we'll keep going. All right. See how much food particles have come off? That's a good sign. It means that we're getting the rest of the bacteria out of your teeth. Great. Your teeth look awesome. Okay, you can close. Wonderful. I bet that feels amazing. Okay. I'm gonna take one more look, and then I think we'll be done with your teeth. So just open wide. Great. Thank you. Looking around, your teeth look so much better. See that one spot though? I missed that one spot, so I'm gonna go back quickly and get the rest of that. And then we'll make sure that we brush your teeth one more time before you leave. So. Good thing is there isn't much, just a little bit. Alright. Alright, great. I'm gonna take my toothbrush one more time and just brush all your teeth to make sure that I've got everything. Okay, so just stay still. I'm gonna... Yeah, there we go. Awesome. Great. Okay, I think you're all done. Just bite together. Okay, I'm gonna look both sides and open. There we go. Yeah, your teeth look amazing. Much better. And I'm glad we got everything removed that we needed to. I'm just going to feel around. Everything feels good. All right. Okay, so if you'll just follow me back into the office, I will get you checked out, and then you're good to go. All right, great. Thank you so much for coming. I hope your experience was a good one, and that we got everything done that you needed to get done. So please just remember to pay on your way out, and we'll see you again next time. Also, remember to go onto our business website, like and comment your experience, and I hope you have a great day, and thank you for coming. Yeah, no, of course. Yeah, all right, have an awesome day. Thanks, you too. Bye.